there are difficult situations that develop, in intensive care environments or really throughout the hospital, and they can involve, situations where a patient may encounter a very rapid medical decline for any of many different reasons, but in a situation where a patient is confronted with that, but there's kind of a lack of clarity about what their wishes would be. It's very difficult to talk in advance about what you would like to happen if you were really confronted with just a very significant medical event that would result in a poor prognosis. A lot of families, I think as humans, we have difficulty talking about our own mortality and really kind of trying to put a plan in place that will help our family or our powers of attorney to determine what it is that we would like to happen. But that's very important. And so in situations where there isn't that clarity, you have two things happening. You have, of course, just the immediate stress and really emotional assault on the family members as they're there with their loved one and really having very difficult conversations with the medical staff and hearing that news that the prognosis is poor. And that already is just, it's an emotional crucible for folks. And I've never, ever met a family member that did not struggle in that situation. It's one of life's biggest challenges. But then when you compound that with kind of that lack of clarity about, what is it exactly that my family member would want in this situation? What are their minimum expectations for quality of life? And that, that question about, what exactly is a patient's prognosis and what are their minimum expectations for quality of life? Those two questions are very important in helping to direct care, really in any kind of an environment, but especially in that emotional crucible of an environment in a hospital or in an ICU, where the doctors are really, trying to also to weigh that, those wishes, as they're recommending care and that kind of a thing.